Hello, everybody. Dr. Frankie here, and it's Thursday, and I have an awesome topic to cover today that I hope you all will find really helpful. But before I jump into today's material, I want to encourage you to subscribe to my channel. It motivates me to be here every week, knowing that people are getting something out of the content that I'm sharing. So if you haven't subscribed, please do. For those who have, thank you so much for doing that. And if you think anything I put out there is going to be helpful for somebody that you know, I want to encourage you to share. And also comment, like. If you have something that you have on your mind that you are wondering what I think about it, or you're wondering what the research is about it or surrounding it, let me know, comment below, and I'll be happy to do the research and put some helpful information out there. In the meantime, please also look for me on social media under Dr. Frankie Bichon. I have an Instagram, a TikTok, and Facebook. And also I have a matchmaking company for heterosexuals and also for LGBTQIA+. So check us out at littlegaybook.com or Little Black Book Matchmaking or drfrankie.com. And if you're single, fill out a confidential profile. And if we have a matchmaking client that may be a match, we may reach out to you and coordinate a date. So without further ado, I am going to jump into the material. Today, we're going to be talking about tips for having sex with vaginismus, or when penetration is just really painful. Sex can be awkward, unexpected, or clumsy, but it shouldn't be painful. But for some people, even when they're enthusiastic and they're excited about penetrative sex, actually can have it feel really painful or much more difficult than it should be. If this sounds like you, or you've struggled in the past with using tampons or penetrative toys while masturbating, it may be related to vaginismus. It's a condition that can cause muscle spasms or contractions that make sex difficult or painful, and it can be really frustrating, but it doesn't mean you can't have fulfilling sex. Understanding vaginismus and related conditions. How do you know if you have vaginismus? Conditions related to vulvas and or women's health are often under-researched and not well known. You may have been experiencing vaginismus or something similar without realizing it. Vaginismus is a condition characterized by involuntary muscle contractions or spasms of the pelvic floor muscles. It can feel like everything's closed up and really locked up and tight. And specifically, those muscles that surround the vagina, which is also called the vulva, get really, really tight. These contractions can make penetration difficult or nearly impossible, as they can occur in response to attempted vaginal penetration. So the signs and the symptoms of vaginismus may include pain during penetration. One of the most common and noticeable symptoms is pain or discomfort when attempting vaginal penetration, such as during sex or a gynecological exam or the insertion of tampons. Involuntary muscle contractions. That means that the muscles around the vagina opening may tighten involuntarily, making it really challenging or impossible to insert anything into the vagina. Burning or stinging sensation. Some individuals with vaginismus report a burning or a stinging sensation during attempted penetration. Difficulty with gynecological exams. Vaginismus can make pelvic exams or visits to the gynecologist extremely uncomfortable or painful, so much so that folks may even avoid going for their yearly exam. Fear or anxiety about penetration. Past history of pain or discomfort means people with vaginismus often anticipate or fear the pain associated with penetration, leading to anxiety, then avoidance of sexual activity or gynecological exams. Individuals with vaginismus may avoid sexual intercourse as well and other forms of sexual activity, which can strain intimate relationships. Frustration or distress. Vaginismus can lead to significant emotional distress, frustration, and feelings of inadequacy or failure in the context of intimate relationships. If this sounds like you, it's possible that vaginismus or a related condition might be part of your health profile. And it's a good idea to speak to a professional about it who can actually help you, because you don't have to live with so much discomfort, I promise you. Seek professional help if possible. A healthcare provider or a specialist in sexual medicine can help diagnose vaginismus. even if you're pretty sure that's what you have. A professional diagnosis can be the key to getting access to other treatments or referrals to specialists who really can help you. A professional can also provide guidance on appropriate treatment options. For instance, a pelvic floor physical therapist can teach you exercises and techniques to release and strengthen your pelvic floor muscles. They may use biofeedback and dilators to help desensitize and relax the vaginal muscles over time. Although it may feel unnecessary for a psychological issue, I'm sorry, not psychological, I'm a psychologist, so it's always psychological, but in my mind, anyway, physiological issue. It actually can also be psychological, right? Because we build it up in our minds and we have so much anxiety and fear of it happening, but it's really a physiological involuntary response. But seeing a sex therapist can really help, or a traditional therapist who's competent at addressing issues related to sex and relationships can be enormously helpful. Vaginismus can be emotionally and psychologically impactful, from the fear and anxiety associated with penetration to the more abstract stigma of feeling that something is actually wrong with you, or a fear of disappointing sexual partners. A sex therapist can help address these fears and help you find a baseline of confidence and self-assurance in navigating your sex life with vaginismus. Communicate openly with sexual partners. You know how I always talk about communication and how important it is. In order to have any sexual partners to be on board with what you need during sex, as someone with vaginismus or a related condition, they have to be in the loop. Talking with partners about problems related to sex can feel uncomfortable, unsexy sometimes, but a good partner will be enthusiastic to understand more about you so they can be a better sex partner. This doesn't have to entail giving someone your entire medical history or even sharing a diagnosis. For casual partners, even something like, hey, I don't always want penetrative sex, I'll let you know if I do, that kind of thing. For long-term partners, it's good to help them understand not just the immediate impact of your vaginismus on the immediate sexual acts, but how living with the actual condition impacts you broadly. Do you want more communication than their past partners might have because you don't know how you'll be feeling on any given day? Maybe. Do you feel some insecurity or anxiety about sex because of it, and you need some patience around that? If you feel pain during sex, do you want to switch to another activity or pause entirely? Consider an expansive definition of sex. One of the most important things to remind a partner, and yourself for that matter, is that not having penetrative sex because of vaginismus isn't the same as not being able to have sex at all. Sex, oral sex, sex with external toys, anal, kinky sex, and even scissoring are considered by many more enjoyable and more important to their sex life than vaginal penetration anyway. And discomfort around receiving penetration for any reason doesn't mean you can't have penetrative sex at all. Maybe you and your partner would like to see what it's like when you strap on, for example. Like, being creative and trying new things is important. Set yourself up for success. Living with vaginismus can feel really frustrating, but you aren't powerless to improve your sexual experiences and physical pleasure. Finding a lube you love can make a major difference, and working with a partner to learn what feels best for you with the support of a physical therapist or other professional, tools like dilators can make a big difference as well. And most importantly, let yourself focus on pleasure with your partners and ask them to focus on your pleasure as well. Extend foreplay and a sense of safety and connection with your partner, and go long, and it will go a long way towards relaxing your body and mind and letting you enjoy sex fully. So the message here is communication, 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 and get support. You're not alone. Many folks struggle with vaginismus and other sort of, ways in which our body might respond to sex. Sometimes it has to do with anxiety. Sometimes it's just a physical involuntary response. And there's a lot of support out there. Even though it may feel like there isn't, there are specialists. So go ahead and make the phone call and get an appointment, and and communicate. So thanks so much for checking in and with me today on a Thursday. And I'll be here next week, and big hugs, big kisses, and I'll see you then.